Coronavirus is spreading throughout America's state and federal prison systems. I spoke to one man who's serving life inside a California state prison. He asked us to withhold his name because he has a contraband cell phone. He's in one of the facilities where a worker tested positive.
So this is what social distances look like inside a prison. As you can see, I'm showing you the day room at the facility that I'm at. And as you can notice, there's a number of inmates freely walking about in the day room. So all it takes is just one person in here to become infected with the coronavirus, and it's a wrap. Everybody's going to be infected.
How in the world is this system going to deal with COVID-19?
All it takes is for one person to come into this environment that's affected, and boom, you got a crisis on your hands. And my biggest concern is it's not so much getting it from the prisoners, it's getting it from the correctional staff.
What are the correctional officers doing when they're coming in? Are they getting checked for fevers?
Well, I've been informed that they are being screened each day that they walk in. This is not one of those things where you can just simply ask if someone has symptoms and clear them to come into work into a dense populated area.
If you started feeling some of the COVID-19 symptoms, how long would it take you to see a doctor?
They have a nurse that's visiting the building every day. The problem with that is, I think for most prisoners, they would be afraid to report that because it automatically is going to result in them being isolated in the hole.
In terms of the commissary, are you able to get Lysol wipes, bleach, anything to disinfect and keep your area clean?
I gotta laugh at that. Are you kidding me? The commissary don't sell nothing but junk food. You hear me? In terms of disinfectant, as a matter of fact, they have a limitation on the number of soap that you can buy.
So how are you supposed to wash your hands as often as we're supposed to wash our hands with just 4 to 6 bars of soap a month?
I think you just answered the question to one of the biggest contradictions. So on paper, it looks good. When you look at what their protocols are for this, they're talking about they're passing out extra soap, that they're doing extra cleaning, that they're passing out disinfectants of this type of and sort. Yeah, that's not the reality in here.
This is what's happening right now inside the California Department of Corrections. We're sitting ducks in here.
I reached out to the California Department of Corrections and Rehabilitation. A spokesperson says she cannot answer my questions without knowing which facility the inmate is in, but we agreed to his request to not reveal that information. I then sent more general questions about protocols for the entire prison system, but have not heard back yet.